Last year, there was a lot of controversy in the medical literature, in the breast imaging world, about screening mammography, when to start screening, how often to do it. Obviously, that leads to a lot of confusion in everyone's minds. When are we supposed to do this? When are we supposed to start having our screening mammograms? But one of the things that I think patients need to know, and women need to know, is regardless of what those two organizations said, the people that are directly involved in breast cancer care, meaning the radiologists that are reading the exams, the surgeons that are doing the breast surgery, the OBGYNs who are seeing you and doing your breast exams, none of those organizations have altered their guidelines. And those guidelines are simple and straightforward and easy to remember. And it's plain and simple: start at 40. Start at 40 and do a mammogram every year thereafter. The thing to remember is screening mammography is basically entirely designed for patients who are asymptomatic, patients who have no problems, who have feel no abnormalities in their breasts, don't have any pain or anything like that. Basically, it's designed to be a general tool to give women peace of mind, to know that there is nothing abnormal in their breasts. But what's a diagnostic mammogram? Well, the difference is a diagnostic mammogram we tailor to a problem that patient may have. So in other words, a patient may have an abnormal screening mammogram, and we'll do a diagnostic mammogram to specifically address that issue. Similarly speaking, a patient may feel a lump in their breast, so we do a diagnostic mammogram with specific views to address that lump and address that area of concern. Mammography is the only consistent study that can be done that will actually find the greatest number of breast cancers while at the same time minimizing the number of false alarms. The other thing that we do know is that there is actually no organization that has denied the fact that mammography saves lives. In large population-based studies, the overall mortality from breast cancer has decreased nearly 30%. Most of that is due to mammography. And all of the major organizations in the country and in the world agree to that. Mammography works. Well, what about breast ultrasound? Breast ultrasound is a great tool, but what we use it primarily for is as an adjunct to mammography. We use it along with mammography. Because mammography is so good, sometimes you need something to make it, to clarify or further study an area of concern that a patient or a woman might have. And ultrasound is that perfect tool to do that. It lets us focus our evaluation to a specific area of the breast. Now, there are patients that do benefit from screening ultrasounds. There have been a lot of studies that have been done that have looked at that, and large studies that have a lot of validity. And particularly those are useful in patients who have dense breasts and patients who are overall younger and at increased risk of breast cancer. Screening ultrasound is an important part of the armament. But the key thing to remember is it doesn't replace mammography. Mammography still is our #1 go-to tool in all those patients.